Well, welcome to At the Capitol with Corey, with State Representative Corey Kath. I'm Mike Howard. Representative, thanks for joining us today to talk about some health and human services issues and bills that you're working on at the legislature.
Yeah, well, first and foremost, I'm honored to be here today working with you as we're progressing on a lot of different bills that are before us here at the Capitol. And one of those that I'm really proud to offer is not the work of me. It's the work of a constituent back home who had a situation happen to her, unfortunate situation, and wants to see something change up here. And I will tell you that it's probably one of the greatest levels of pride of any legislator is when you can work with that constituent back home who says, you know what, something must be done here, something needs to change, and we can work with them to actually be a catalyst for that change. And so I'm excited for this bill moving forward.
And that person is going to come actually to the Capitol, I understand, to testify. Talk a little about the bill and the work here.
Great. Well, the constituent's name is Beth Bauer, and she contacted me actually. Well, I contacted her first because there was an article in our newspaper. And what ended up happening, she has two medically fragile children, and she had some home health aides. And home health aides are individuals who provide the care and service in the home, and specifically are trained in certain medical aspects to help people out. And oftentimes they will help the owner of the home. In other words, there might be an elderly individual that they will go in and serve. But in this situation, it was Beth's children. And so this home health aide was coming in and committed some very bad acts in the home. And you know, a person's home is their castle, right. And you would expect that a home health aide that would come in and offer assistance to her children would be doing the right thing. And clearly that was not what happened, and the experience resulted in criminal charges and some real difficulty for Beth and her family. As well as just that level of being, I'm vulnerable now, and how can we make sure that this doesn't happen to somebody else?
So what kind of legislation is being put together to address this or to really look at this problem?
And we're looking at it in a few different contexts. First and foremost, we're looking at ethical training, and specifically saying that there are so many gray areas. When a home health aide goes into somebody's home, the training that they need is not just about the medical procedures, but about how do you interact with those clients, what is the right and wrong thing to do, because there are so many different nuances to that, as well as understanding your client and what the client wishes. You are providing a service in that home, and there are certain things that you should not be doing, whether it be not paying attention, falsifying records, stepping out to have personal conversations, or having personal guests come to the home. All things that for a lot of people would be common sense, right. But we need to then advance that training to make sure that we are addressing these issues and those gray areas that are out there. So what we're proposing is that every home health aide would have ethical training as part of their program before they would actually be deployed into homes, as well as they have to do continuing education. So in other words, during their year of service, they must do continuing education opportunities. And what we'd like to do is see that they get some training on ethical decision making and ethical processes in their field. And finally, that the homeowner or the client should have the right to be able to question whether or not the person is getting that training. You should be able to find out what is the training that home health aide is working on. And finally, then we'll be looking at some different aspects of supervision, and specifically how we can strengthen the supervision process so that this does not happen to another family.
And like you said, some of these things might seem like common sense, but when you hear a personal story and what has happened, it's clear that there needs to be some sort of training there so they can really see what's what. And
you know, we've had such great support from so many different layers and levels of people coming forward and saying, you know, we understand something does need to be done. From the small little mom and pop home health aide group to the very large providers that have home health aides as well, all saying, you know what, you're hitting the nail on the head here. We do need to come to a focus here. We do need to work on this piece of legislation.
We only have about a minute left. I know there's another bill that you're working on called the Kyle Herman bill. Quickly, what is that legislation?
Well, yes, what a great bill this is. Representative Tim Mahoney had some students come to him with a great concern about a child in a school setting. He had Down syndrome, was nonverbal, and the teacher was actually physically abusing this child. And very, very unfortunate for his parents. When you have that expectation that when you send your child to school that they're going to be treated well and that you should have no concern whatsoever as they enter those school doors. And that trust was broken. And so Representative Mahoney brought forward a bill with the help of Concordia University students from St. Paul. And what that bill does is it makes sure that parents are part of that process. That when we hear about an investigation that's moving forward about a teacher doing something as devastating as this in their classroom, that the teachers that the parents, excuse me, should be notified right away of an investigation so they can be part of that context and part of that conversation, because right now that's not happening. And those parents need to be involved within that.
Absolutely. I think a lot of people would be surprised that that's not already happening.
Absolutely. And you know, and that's that first step. And I just had some of the students come talk to me today, as well as I spoke with the Herman family and let them know that this is just opening the door a little bit. We're going to open this even wider next session, looking at some issues of just mandated reporting in general. And that is that as an educator myself, I am mandated to make sure that we are looking at that abuse and we are reporting that abuse that may be out there, whether it be by a faculty member, whether we think that that abuse might be resulting in the home, wherever it might be, and strengthening that so that we have a better method of hearing about those concerns, hearing about those issues, and making sure that we get down to the bottom of it, and that is protecting kids.
Yep. Representative, thanks for joining us in the studio to talk about all these issues, and we'll have you back in a couple weeks.
Great, thank you.
This has been At the Capitol with State Representative Kath.